I'm Dr. Mike Milligan. We're at the Chicago Midwinter Meeting, and I'm with Mike Cataldo of Convergent Dental, the CEO. Mike, thanks so much for being with us.
Mike, thanks for having me.
Well, great. So this is the latest thing in lasers. It's only been out a few months, 3 years in the making. You're from the Boston, Massachusetts area. Mike, tell us what is so unique about the new Solea laser.
Well, Mike, there's a lot that's unique about it. First of all, it's the first CO2 laser ever cleared for hard tissue.
Right.
It's the first 9.3 micron laser ever approved for anything.
And most CO2 lasers are 10.6.
10.6 is native CO2, known for soft tissue cutting, the gold standard for soft tissue cutting.
Right.
And we're at 9.3, which is near the peak absorption of enamel, which means we actually vaporize enamel. Exactly. The only laser that does it.
Which is different than it was before.
Right.
So that's great. So what else?
Well, the computer controls. So it's the only computer-aided preparation system in dentistry. Yeah. Computer plays a huge role. And
by the computer, that means you manipulate those mirrors how fast?
We have mirrors inside the handpiece that move up to 10,000 times a second.
Previous ones moved how often?
There aren't any previous ones, Mike. We're the first ever to do it.
All right, there you go. So a lot unique about the science with this. It's 3 years in the making, just out. What procedures can this laser do?
Well, it can do just about anything you can do in the oral cavity. So we're cleared for both hard and soft tissue. Our dentists, as I like to quote David Fanarella, he says, I use it on every patient every day. Now, it may not be every patient, but the fact of the matter is that it overcomes the limitations of erbium that made it a part-time tool. So we're not limited by decay, we're not limited when it comes to interproximal cutting. If you start a box and you need to extend it, all those things that are known as limits for erbium, we have none of them.
Now, Mike, you said you're cleared for the different procedures, but you didn't say by the FDA, and you are.
That's right.
So you're FDA cleared.
Right.
For hard and soft tissue procedures. So tell me a little bit about that. What about the hard tissue?
Okay. So for hard tissue, we're approved for ablation of hard tissue, for caries removal, and cavity preparation. That's it.
What about soft tissue?
Soft tissue, we're cleared for incision, excision, ablation, hemostasis, and coagulation.
That's a mouthful.
That's
everything.
It's just about everything you can do in the oral cavity.
Exactly.
Yeah. So what's great about it is we don't need all the specific indications.
Right.
Because that pretty much covers everything.
You get in the mouth and you just start going, and you just go from tooth to soft tissue to tooth to bone to whatever you need to do, all right there. One laser.
That's right. That's one of the great advantages of it, because it's one tool. You simply change settings.
It's amazing how fast and clean and smooth this cuts.
Well, that's right. Now, that's a function of the wavelength and the computer controls. Right. So can I give you an example?
Sure.
So erbium, once again, is day, fine, medium, but erbium users will pulse the laser. They'll put about 15, maybe 20 pulses per second into the tooth.
Yeah.
Okay. This one, by contrast, 10,000 pulses per second. So we're putting 600 pulses to 1.
Right.
Compared to erbium. And the reason is it's all about the wavelength. 9.3 microns is very highly absorbed in enamel, so it means it doesn't penetrate, it's absorbed. So it's a very shallow cut per pulse.
Right.
But we go at it 10,000 times per second. Erbium only vaporizes water. So it vaporizes a limited amount of water in the enamel and chips it off in chunks. Right? So as a result, it's slower and it's less precise.
Right.
So we get speed and precision. It's like the difference between using an axe and a chainsaw.
Yeah.
All right?
You look at the difference in the cuts, and you can see photos of this. And I was seeing it clinically here. But the difference between the erbium and what you have, this is so much cleaner and so much clearer. Such a nicer cut. And it's fast. It really shocked me how fast I was able to cut that enamel, and how accurate and how smooth it was.
Well, I'll tell you, I'm glad you brought that up, because it is fast, and one of the key features is the rheostatic foot pedal. So that's right, it's the only rheostatic foot pedal on any laser in dentistry. So you actually control the speed by feathering up and down on the pedal. And what our dentists tell us, they don't even use the fastest settings on the system. They kind of start in the middle and use the pedal to control it.
Right. It was so easy to use because, like you say, you've got that foot pedal, and then just the controls are simple on the unit.
Yeah, we did that on purpose. We wanted this to be, yep, we wanted non-laser dentists to have an easy transition from the drill. We didn't want to talk about watts and millijoules, and I think there's one, the term pulse shows up on the screen somewhere, but that's about it.
Right, very simple to use, very quick, very accurate, really nice cut on soft tissue, and got only good things to say about it. What are some of the other dentists that have used it? What's the experience out there? I know you've had several people using this already.
Oh, that's right. We've done thousands and thousands of procedures, and what our dentists are telling us is 95% anesthesia-free. And when we say, we mean anesthesia-free, beginning to end of the procedure, and they tell us that 95% of the patients say they feel no pain. So it really is changing the dental experience. And I've watched it. I've watched it whether they're 100% laser preps, or even preps where you have to use the drill to clean up the margins. Patients don't feel anything.
Because you've got some anesthesia that tooth just by the use of the laser.
Well,
they would clean it up with the drill if they wanted to do that, but didn't need to.
Well, that's right. So lasers do have an analgesic effect, right? And that's a very important part of the new experience.
Yeah, great. What else would you like to tell us about the laser before we close here?
Well, I think we covered all the important points. But to learn more, the best way to go about it is just go to our website, which is convergentdental.com.
What about convergentdental.com? What about the support?
Oh,
let's talk about that.
Yeah, support. I mean, it's very important to us.
It's good, by the way. It's good. But tell our viewers about that.
Well, the whole experience for our customers has to be tremendous. So when we sell a unit, we actually deliver it with a 90-day unconditional money-back guarantee. Number one. So if you don't like it, we'll take it back. Number two, it comes with a full bumper-to-bumper 100% 12-month warranty. And for our users who are on our support program after year one, complete coverage after that as well.
Fantastic. And I want to tell you one other thing. I've spent quite a bit of time with Mike and with the other people in Convergent Dental. They're just good people, and they're going to take good care of you. It's the right thing to do. These are good people. They're going to take care of you. Good quality. So don't hesitate. Get with Convergent Dental. The Solea laser is the laser of the future. I would highly recommend you do business with Convergent Dental.
Thank you very much,
Mike.
Mike.
For being with us.
Appreciate it.